the application of a rapid response EEG system. We're a community hospital. We're not academic. We do not have EEG techs in-house 24/7. So we have 3 very large or 4 large EEG machines. We also have 9 bedside EEG machines in our ICU, our CNS systems, which allow, to be hooked up. But those require EEG techs to prepare and to apply. We have another additional system, which is our rapid response EEG, which anybody can put on in 4 to 5 minutes. And we can start monitoring that EEG within 30 minutes of the return of spontaneous circulation. CT scan, C-spine in case there's any evidence of trauma. If the patient was down or collapsed down, might have hurt their neck. Cardiac evaluation, so there was recommendations on getting a stat echo if that is possible, and then determining the PCI candidate. These are the 3 recommendations that our cardiology team came to consensus about. This wasn't, it was, do you go immediately? Who can be delayed? And so they take into consideration many factors. And so this was the agreement that cardiology and the standard the cardiologist had set down. And then in that patient that's going, we develop these bundles of care. So this is our bundle for the first 120 minutes. And it covers oxygenation, ventilation, cardiac and hemodynamic optimization, consults, metabolic derangements, TTM, early cardiac intervention, neurologic care, seizure care, and families and caregivers. So we have tried to make this as simple as possible for our bedside practitioners. We had great ER staff nurses that were part of this team. They reviewed the evidence, and then they came up with this bedside checklist. So where are things located? We, like everybody in the country, I'm sure in the world, has had issues with staffing, right? We have lots of staff that have left. We have travelers that are coming in. And so you have to still continue care. So we tried to make this, where do you find this? It's on the critical care cart. It's in the med room. So we developed, the nurses developed this bedside checklist to cover that first 120 minutes.